my name is Joseph Ayub. I'm a fourth year medical student at Grant University, and I'll be taking you through this week's case of the week, which is recurrent pyogenic cholangitis, with help from my mentor, Dr. Cruz. We have a 39-year-old woman who presented after a recent workup for persistent fatigue, elevated liver function tests, and decreased appetite. She immigrated to the U.S. from Thailand 4 months ago and has had a long history of intermittent chills, rigors, and abdominal pain. Upon questioning, she stated that she received fluid bolus for fatigue and hypotension prior to moving. A liver ultrasound demonstrated intrahepatic biliary ductal dilation as shown by the white arrow and acoustic shadowing from intraductal calculi demonstrated by the yellow arrow. She got a contrast-enhanced MR of the abdomen. These are axial cut T2 weighted MR images with fat saturation. On the left, the white arrow shows severe segmental intrahepatic ductal dilation within the left hepatic lobe. On the right, the yellow arrow demonstrates multiple intraductal calculi in the right hepatic lobe. A site of biliary stricture is visualized in the central left hepatic lobe by the white arrowhead. These are coronal thin section T2 weighted MR images. The yellow arrows are demonstrating intraductal calculi with segmental intrahepatic biliary ductal dilation in the right hepatic lobe. The image on the far right shows severe segmental intrahepatic ductal dilation in the atrophic left hepatic lobe. The final diagnosis is recurrent pyogenic cholangitis, or RPC, more commonly seen in Asian countries. Patients may present with one or more symptoms of Charcot's triad, and a history of repeated episodes is typical. Fatigue and other nonspecific symptoms are common as well. Our top differential diagnoses are cholangiocarcinoma and primary sclerosing cholangitis. Patients with RPC are at an increased risk of developing cholangiocarcinoma. Imaging features include a biliary or hepatic mass with upstream biliary ductal dilation. Progressive or delayed enhancement of the mass with a rim of peripheral diffusion restriction may be seen on MR imaging. Primary sclerosing cholangitis, or PSC, can mimic RPC on imaging due to the presence of biliary strictures, occasionally with hepatolithiasis. PSC is distinguished by the involvement of both extra and intrahepatic ducts with a characteristic beaded appearance and diverticular outpouching. It is associated with inflammatory bowel disease and more commonly seen in Northern Europe and the United States. RPC is a chronic inflammatory disease of the biliary system characterized by repeated episodes of cholangitis and resulting fibrosis. Etiologies include chronic infection with Hillman's or recurrent bacterial cholangitis, which induce inflammation and irritation to the biliary duct epithelium. A history of living in East and Southeast Asia is also key to diagnosing the disease. The characteristic imaging finding of RPC is hepatolithiasis, typically in the absence of distal extrahepatic biliary obstruction. Biliary strictures resulting in central intrahepatic or proximal extrahepatic ductal dilation with tapering in the peripheral liver is a typical pattern. The left hepatic lobe is more frequently involved due to acute angulation of the left hepatic duct. Initial imaging for RPC is often a right upper quadrant ultrasound, demonstrating ductal dilation and/or calculi as well as occasional gallbladder wall thickening. Contrast-enhanced MRCP is the standard imaging modality for diagnosis of RPC, as it better depicts biliary dilation, atrophy of hepatic segments, intraductal calculi, and bile duct strictures, and can also evaluate for an underlying biliary mass. Lastly, ERCP can be used to provide therapy and cytology assessment for an underlying neoplasm in addition to imaging. Biliary decompression through ERCP and transhepatic biliary procedures is the mainstay for definitive treatment of RPC. If the disease is localized to the lobe of the liver, a hepatic resection can be performed. Prognosis for RPC is variable. Those who underwent surgical treatment may have more favorable outcomes. Serial imaging with MRCP and/or ERCP with cytology may be necessary in surveillance for cholangiocarcinoma. Thank you for allowing us to present this case.